Right after the Second World War, American hospitals were in serious trouble. It wasn't a lack of beds or a shortage of medicine. The problem was people. America was facing a catastrophic shortage of nurses, a crisis so bad it threatened the nation's ability to care for its own. The solution, the one that would ultimately save countless lives and reshape American healthcare, came from over 7,000 miles away, in the Philippines. This is the incredible and often untold story of how generations of Filipino nurses answered America's desperate call. It's a story of sacrifice, resilience, and how a group of determined immigrants became the undisputed backbone of the U.S. healthcare system. Think about it, walk into almost any American hospital today, and there's a good chance the nurse taking care of you is Filipino. While making up just 1% of the U.S. population, Filipinos account for a staggering 4% of all registered nurses in the country, and in states like California, that number jumps to over 18%. This is no coincidence. It's the result of a century-long, deeply complex relationship between two nations, a history that started with colonialism and was forged in crisis. The late 1940s and 50s were supposed to be a golden age in the United States. The GI Bill sent millions of veterans to college, suburbs were exploding, and new hospitals were being built at a record pace. But inside these brand new facilities, a quiet disaster was unfolding. The nurses who had served so bravely during the war were leaving the profession in droves. And can you blame them? The pay was terrible, the hours were brutal, and the working conditions were often poor. The country was building this incredible, modern healthcare infrastructure, but forgetting the most crucial part: the people needed to actually run it. Hospital wards were dangerously understaffed, leading to burnout and even more nurses quitting. Then, when massive public health programs like Medicare and Medicaid were introduced in the 1960s, the demand for nurses went through the roof. The U.S. had a massive problem. It needed skilled, dedicated nurses, and it needed them fast. So, America started looking beyond its borders, and it found the perfect answer in a place its own foreign policy had, by complete accident, prepared for this very moment. This story really begins decades earlier, in 1898, when the Philippines became a U.S. colony after the Spanish-American War. As part of a colonial project called benevolent assimilation, the U.S. set out to remake the Philippines in its own image, and a huge part of that was establishing an American-style healthcare and education system. The U.S. Army started training Filipinos as nurses, and by 1907, American-style nursing schools were set up across the islands. The curriculum was in English, the textbooks were American, the techniques and professional standards were identical to those in the U.S. This colonial policy had an unintended consequence. It created a huge, ever-growing pool of highly skilled nurses, fluent in English and already trained in American medical practices. They were, in essence, tailor-made to step directly into American hospitals without missing a beat. Laws like the Pensionado Act of 1903 even sponsored Filipino scholars to study in the U.S., and some chose to stay. So by the time America's post-war nursing shortage hit its breaking point, the Philippines had a surplus of nurses trained specifically for the very system that was now desperately looking for them. It was a crisis and a solution that were, in a way, a century in the making. The first big wave of recruitment started with the exchange visitor program in 1948. It was supposed to be a cultural exchange to counter Soviet propaganda during the Cold War, but it quickly turned into a pipeline for U.S. hospitals to recruit Filipino nurses on temporary visas. These were the pioneers. They were often young women, leaving everything they knew behind for a country they'd only read about. Drawn by professional opportunity and the dream of sending money, remittances, back home to support their families. The journey was anything but easy. Many were hit with a profound culture shock. They found a healthcare system with things like nursing homes, which just didn't exist back in the Philippines. They faced ugly discrimination and stereotypes, with patients and even colleagues mocking their accents or questioning their skills. Then, in 1965, the floodgates blew wide open. The landmark Immigration and Nationality Act was passed, getting rid of the old restrictive national origins quota system. It prioritized skilled workers and family reunification. U.S. hospitals, fully aware of the talent in the Philippines, started recruiting nurses directly, offering them not just jobs, but green cards and a path to citizenship. This triggered a mass migration. For thousands of Filipino nurses, it was a golden ticket, a chance at a better life for their children. But that life was built on sacrifice. They worked double shifts, often in the understaffed and undesirable units that American-born nurses tried to avoid. They took care of the sickest patients during the toughest health crises, like the HIV/AIDS epidemic in the 80s. At a time when fear and stigma led some healthcare workers to refuse to even treat patients, Filipino nurses stepped up, filling that void with compassion and professionalism. And through it all, they sent a huge portion of their paychecks home, fueling the Philippine economy and lifting entire families out of poverty. Today, it's impossible to overstate the legacy of those first waves. Filipino nurses aren't just part of the U.S. healthcare system, they're essential to its very function. You'll find them at every single level, from the bedside to the boardroom. They're clinical specialists, charge nurses, hospital administrators, and leaders of national nursing organizations, like Zene Triunfo Cortez, the co-president of National Nurses United, who is a fierce advocate for frontline workers. This legacy of service was thrown into the spotlight in the starkest way imaginable during the COVID-19 pandemic. As the virus crushed hospitals, Filipino nurses were once again on the front lines of a terrifying health crisis. They worked in the most dangerous, high-exposure jobs, often in the ICU and ER, and they paid a devastatingly high price. The statistics are just heartbreaking. Remember, they're only 4% of the nursing workforce, but reports from 2020 and 2021 showed Filipino nurses accounted for nearly a third of all nurse deaths from COVID-19. In California, where about 1 in 5 nurses is Filipino, they made up almost 70% of nurse COVID deaths at one point. They faced these risks with incredible bravery, often driven by a cultural value known as kapwa, this sense of a shared self, a deep empathy that sees a patient not as a stranger but as family. Some, like Celia Yap Banago and Rosary Castro Olega, even came out of retirement to help on the front lines, a final act of dedication that tragically cost them their lives. Their sacrifice, and the sacrifice of so many others, was a painful reminder of the immense debt America owes its Filipino nurses. So, the story of how Filipino nurses came to save America's hospitals isn't just a simple immigration tale. It's a story born from the complexities of colonialism, shaped by crisis, and defined by incredible human strength. What started as a fix for a labor shortage became something so much bigger. Over 150,000 Filipino nurses have come to the U.S. since the 1960s. They didn't just fill gaps in hospital rosters, they built communities. They raised families, put down roots, and made the cultural fabric of this nation richer. They weren't just imported labor, they were pioneers who faced down hardship and discrimination to give the best possible care. From the post-war boom to the AIDS crisis to the COVID-19 pandemic, they've been the calm in the storm, the steady hands and compassionate hearts at the bedside when America needed them most. They are, without a doubt, the backbone of American healthcare, and their story of sacrifice and service deserves to be told, honored, and never, ever forgotten. The story of these nurses is such a powerful testament to resilience. If a Filipino nurse has ever made a difference in your life, or the life of someone you love, we'd be honored if you shared your story in the comments. Let's fill this space with gratitude for everything they've given. Thanks for watching, and don't forget to subscribe for more hidden histories just like this one.